Good morning, everybody. This is Sanchita from Birla Heart Research Center, CK Birla Hospitals, and with me today I have Dr. Anil Mishra, the Director of Cardiology at Birla Heart Research Center.
Good morning.
So, about sir, before we start, I'll just like to give a brief introduction. Dr. Mishra has graduated from the Calcutta National Medical College and received his postgraduate training in the United Kingdom. After achieving membership of the Royal College of Physicians, he's trained in cardiology at some of the leading cardiac centers in Europe. And we have Sir as a specialist of pacemakers, and today's our topic is pacemakers. So about that, I'll like to say he has wide experience in cardiology and has performed many coronary angiographies, coronary angioplasties and stenting, pacemaker and other cardiac device implantation, and he has a very special interest in complex angioplasties, pacemakers, CRTD, AICD and TAVI. So today our topic of discussion is basically all about pacemakers.
Sure.
So people do have a lot of questions regarding that. So first, sir, I would like to ask you, who actually needs a pacemaker?
Basically, to understand who needs a pacemaker, you need to understand that heart works as a muscular pump on receiving a microelectrical impulse, which is generated in the upper chamber of the heart and is conducted through 3 wires to the lower chamber. And when the lower chambers receive that impulse, they contract, and that is when the heart's pumping action goes on. Now, if there's a problem with generation of the microimpulse or in conduction of the microimpulse to the lower chamber, either of the two, you would often require a pacemaker to compensate it if the cause is not a temporary one. So when you say sick sinus syndrome, the pulse generator of the natural pulse generator of the heart is diseased, it cannot generate adequate impulses, then you require a pacemaker to generate adequate microimpulses. Or if the 3 wires we call right bundle, left bundle, anterior vesicle, posterior vesicle, if they get blocked, if any one of them is functioning, you don't need a pacemaker. But at some point of time, if all the 3 are non-functioning even for a few seconds, your heart may come to a standstill, so you may require a pacemaker.
Okay.
So that is when you have complete heart block, second degree heart block, and so on and so forth.
All right. So, sir, another question is that how will I understand that I have something like what are the basic common symptoms that I understand that I need a pacemaker?
Yeah, the dramatic symptom most often which brings people to doctor is usually a blackout, a sudden loss of consciousness for few seconds or maybe few minutes, and then they wake up and return back to normalcy immediately. If that happens, it is highly likely it's a cardiovascular cause. You should go to your cardiologist to get assessed rather than a neurologist. Neurologists, usually people who go unconscious because of neurological causes, will have a little prolonged episode. They may fall unconscious for longer periods. When they recover, they are confused or they may have convulsions, and takes me half an hour, 45 minutes to recover to normalcy. So those people may need to see neurologists, but unfortunately, a lot of people who are clearly cardiac syncope, as we call them, these blackouts, they land up with neurologists rather than a cardiologist. So sudden blackout or sometimes sudden giddiness, momentary giddiness for a few seconds to few minutes without any rhyme or reason, and then it recovers spontaneously, and visual blackouts of that sort, not actually falling down, what we call pre-syncope. These could be the common symptoms where you require a pacemaker possibly, or also sometimes when your heart rate becomes too slow and does not accelerate as per the body requires when they exercise. So this is sick sinus syndrome. So it may slow down suddenly or inappropriately, or suddenly become very fast inappropriately. This is a sick sinus syndrome where you often require a pacemaker if you are symptomatic from it.
Okay, so the first thing is that you need to visit a cardiologist to assess your situation. So now the question is that, a pacemaker is a device and something implanting inside me, or device you're implanting inside me. So people have a lot of questions about it.
Sure.
Firstly, how big is a pacemaker?
The pacemakers, when they started long time ago, they were pretty big in size, but now it is fairly standard. You can see a common pacemaker is about this size, which is not a lot, and we just give a small local anesthesia incision there and implant it under the skin. That's where it's implanted, usually on the left side, but it could be on the right side as well. And this is what a common pacemaker looks like, basically. And of course, this connects to the heart through a lead. And this lead is there, you can see. This lead has got an electrode which goes inside the vein there and goes into the heart. But this is not, you don't have to cut open any heart or anything. It is just when patients are conscious, they're talking, it is just done on local anesthesia. you puncture the vein through a needle, and through that you pass down this lead to the heart. So that is how you place the heart.
So since you have talked about the pacemaker and the lead, I would now like to ask you that there are certain advancements in pacemakers, as you have only educated us, that there are leadless pacemakers. So what are those?
Right. The unfortunate part is when you have to implant a device and create a pocket and put in a lead, there are a lot of possible complications happen. They of course they are not frequent, but they happen because of you have to have surgically open and you have to implant a lead. So there are now leadless pacemakers which are very small. You can see they're tiny little things. I mean the size of a capsule only. Okay. So you can see they are implanted through the groin going into the heart and implanting it inside the heart. They are very small in volume. They can almost 0.8 cc in volume. So they are implanted and they look small, but the battery life is same as a standard pacemaker what is implanted from the subcutaneous pocket.
Okay. So another thing is that how does it exactly work, sir?
Right. Pacemaker keeps on watching your heart rhythm all the time. So as long as your own heart rhythm is coming, it keeps on watching it. But when your own heart rhythm fails to come, either fails to generate or fails to be transmitted to lower chamber through the conduction system, then it supplies the electrical impulse to the upper or lower chamber wherever it is required to keep the heart going at the same pace as it has been programmed to. So it never allows your heart to stop. So this is how pacemaker works and prevents any blackout or loss of consciousness and symptoms. And they can accelerate the heart rate as well according to requirement of the body. So you are not short of breath on exercise either.
Okay, so if I am having a pacemaker inside me, do I feel it all the time?
Well, very initially it's like a filling in your teeth. When you have a fresh filling, you may feel there is something there, but after a few days you just forget about it, it becomes a part of your body. So this also, when you implant it, there's a small scar which takes about a week, 10 days to heal. So you may feel it, something is there. You may sometimes feel a slight projection as well, because if you are thin, it can be seen under the skin, so you can see the little projection. But in people who are well built, you can hardly ever notice it even. And after a few days, people even forget about it. They have a pacemaker. You can't make out externally they have a pacemaker unless you see a small little scar there. That's all.
In the meanwhile, I'd like to ask my audience that if you have any question for Dr. Mishra today through the live, he's here to answer. So if you have any queries regarding pacemakers or any other thing, you can definitely ask us here. So going forward, sir, how like you have already briefly explained how the pacemaker is implanted, so if you can just elaborate on how it is implanted, because there's a very common question that we get: does the heart need to be stopped during a implantation?
I think that's a very wrong notion. We do not need to stop the heart at any point of time while we are implanting the pacemaker. And a common notion is it's a major surgery. In fact, we cardiologists, intervention cardiologists, we implant the pacemakers. We don't require a surgeon, we don't require anesthetist for that, and it's not even done in OT. It is done in cath lab where we do angiograms, angioplasty, etc. All we need to do is make the area clean and sterile with a draping and dressing with betadine and with chlorhexidine and other sterile solutions. Once the area is sterile, we just give a local anesthesia, and when the area becomes numb, we give a very small scar, enough cut to allow the pacemaker to go under the skin, only that much size. Once you create the scar, and through that we create a pocket, and we take a needle and puncture the big vein which is going through here towards the heart. And through that puncture, we can pass down this lead which is there. You can see this lead is passed down easily because it's a cavity of the vein. It doesn't hurt or anything. You cannot feel anything. This goes down into the heart, and we place it at a particular specific positions where we like it to be, towards the apex of the heart along the inferior wall. And when we check that they are satisfactorily pacing or not, whether the pacing threshold is high, is it requiring high energy to pace, or is it pacing at a very small energy? Because to have a proper longevity of the device, you need to pace at a low energy. Once we achieve that location, we test the stability of the lead. Once it is there, we'll connect it to the pacemaker through the other end. We just connect it, and then once it's connected, we anchor it here under the skin, insert it, and stitch up the skin. And that's it. Very simple. It takes about 45 minutes to 1 hour to implant a dual chamber pacemaker, because pacemaker can be single chamber or dual chamber. Single chamber will take probably half an hour only, 25 minutes to half an hour, and dual chamber 45 minutes to 1 hour. And the patient is awake and talking all throughout the procedures. they don't feel much of pain. They may feel a little bit of pushing and pulling because of the handling of this area, but they don't feel much of pain. And later on, we can give the painkillers for 2-3 days, and they're quite okay.
So, sir, since you have already mentioned about the single chamber and dual chamber pacemakers, can you elaborate on that, please?
The single chamber pacemaker paces only one of the chambers of the heart. You have upper chambers and the lower chambers. Upper chambers are the receiving chambers and the lower chambers are the pumping chambers. So most often earlier days, it used to be lower chamber pacing only, which is the main pumping chamber, but that led to loss of synchrony between the upper receiving chamber and the lower pumping chamber. As a result of that, the cardiac output may have dropped. Now, most of the time, we are putting dual chamber pacemakers, which maintain the synchrony between the upper chamber contraction and after a few seconds, not seconds, few milliseconds actually, a lower chamber contraction, so that they contract in sequence, and synchronized contraction leads to a better cardiac output. But we also have a number of advanced features in these pacemakers now. They can automatically measure what is the capture threshold, which means what is the amount of energy required to pace the heart, and adjust the output accordingly. They also can record whether you have had a rhythm disturbance. Suddenly, suppose your heart rhythm becomes very fast, it can record it and store it inside the device, which can be interrogated later on. They also measure the lead impedance, whether position is good, whether there's a fracture in it, or whether it's good dislocated. Then you change the impedance, you automatically see a change in impedance, which is dramatic. Or of course, you can also have an MRI safe pacemaker these days, because normally the metallic pacemakers will prohibit doing an MRI scan for the body, but nowadays we have a MRI safe pacemakers, which can be programmed just before the MRI scan is to be done, so that they can have a safe MRI procedure and they can reprogram back to the MRI off mode after the MRI scan is done.
Okay, so that was quite informative. So now coming to the pacemaker once it is implanted, because we have understood how it is implanted. So how long does it last, and what happens when we need a new battery? Because this is a battery operated system, right?
That's right. The implantation procedure, as we explained, is fairly simple, and we expect the battery to last for at least about 8 to 10 years on average. But if the thresholds sometimes go high, the battery life can become shorter. And if the thresholds remain low and you program the device properly, then you can last for 12 years or sometimes even pull on to 14 years. But these days, some of the newer devices have a slightly longer battery life. They may pull on to maybe 14, 15 years as well sometimes, but they are a little more expensive than usual. The batteries are actually sealed inside. So you will see this is a hermetically sealed unit. You cannot take the battery out of it, because if you have something which can be taken out, this may leak into the body as well. We don't want that to happen ever.
Right.
So this is hermetically sealed. So when you need a change of battery, as to say, we have to change the pulse generator itself. So we disconnect the lead, which was connected here inside.
Yes.
We disconnect it, take this out, put in a new device and connect it to the new device, provided the lead is all right. So once the lead is satisfactory, we just change the pulse generator, as we call it, which is also equivalent of battery change. Because with that, all the circuitry, electronic circuitry of pacemaker is all within this. But since you cannot separate the battery from the electronic circuit in the hermetically sealed unit, you have to change the pacemaker, or we call it pulse generator replacement.
So for the leadless pacemakers also we follow the same procedure?
Right. Leadless pacemakers are tiny things. Now they have a little knob at the end, which is very difficult to see. It's a small one.
Yes.
So you can probably retrieve them by catching onto this knob and taking this out through there is some special retrieval sheets available.
Okay.
You can take this out. It has been tried in a number of cases and it has been successful in a high percentage of cases. But in case, suppose you cannot take this out, then you can implant another one inside the heart, because this occupies only a very small volume. It is 0.8 cc in volume. So you can implant 2, 3, even up to 5 devices have been implanted successfully within the heart, and it does not compromise the right ventricular function or the heart's function at all. So you have plenty of way to go.
So since there is a change of battery and everything involved, so how often does a person need to check their pacemaker is all right or not?
Normally, we would suggest that after implant, you need to check this after 2 to 3 months because some of the initial values of pacing, impedance, thresholds may change because leads get surrounded by edema. There's a little fibrosis around the lead tip when the heart's reaction to it, the tissue reacts to it, and then these changes stabilize at around 2 to 3 months' time. So then you find out what is going to be a chronic threshold, which is going to be stable because initially, early days, it may rise and then fall. And once you have achieved that, you can program a device for long term for a better energy conservation of the device and for better pacing.
Okay. And
Then, of course, you may want to check it once in 6 months at least, because if some parameters change, you will come to know what has changed, if the lead has fractured or lead is displaced or the threshold has risen. Those parameters you can check that it's functioning properly. At the same time, they all can be done wirelessly. We just place an interrogation over the skin here, an interrogation head there, and it interrogates wirelessly telemetry. It interrogates the device, and all the values of the pacemaker can be deciphered from outside, and we can reprogram it from outside without doing any surgery or anything.
so another thing that quite often comes up is that is there any lifetime warranty of a pacemaker? Like if I'm planting it, does it come with a warranty?
Well, yes, the pacemakers do come with a warranty in India. India is fortunate country because in US and Europe there are no lifetime warranties for the pacemakers. But in India, we are fortunate that we get lifetime warranty for the pacemaker. But that does not mean that the pacemaker, what is implanted, will last forever for the lifetime of the patient. All it means is that when the battery runs out, you get a free replacement of the device for the lifetime of the patient. So that is the lifetime warranty. So somebody who implants a pacemaker, they are given a card. Save that card for future because when 10 years time you need sorry replacement, you need to produce that warranty.
So, sir, since you have talked about the
Sorry.
replacement, the card, I want to know something. That is how does that card help us? Because I have heard that in airports, if while driving, there are many issues. Like in airports, if there's a metal detector, and will my pacemaker be detected there? So does that card help us?
It's a very common question, a very common problem. When you go through the airports, they do security checkup, and since it is a metal case, it may trigger off the alarm. So if you are carrying the card, you can show them that you have a pacemaker implanted. So they may ask you to walk outside the metal detector range and check you manually. And even if the alarm goes off, they will know why it is so. So they will not be thinking that you are a security risk. So that's okay. So very simple but very common thing, and you must carry your card when you travel to airport, etc., to alert the security people that you have a pacemaker. Then they can check you accordingly.
So I'll again ask my audience if there are any comments or any questions that you want to ask here. You can definitely ask sir here.
One of the common questions which I think most people ask me is,
Yes.
can they do touch the electricity switch? Can they operate the microwave? But this is a very common misconception that once you have a pacemaker, you cannot do all these things. It is absolute nonsense. You can operate all electrical switches, you can operate the TV remotes, you can operate the microwaves, you can do everything you do normally at home when your pacemaker is there. So there's no restriction on that. Only restriction we have is usually avoid strong magnetic field. And where do you have this magnetic field? Where there's 25,000, 50,000 volt electricity, within 4, 5, 6 feet distance of that, there is a magnetic field generated. So try to avoid that. So that's what you have to, don't go near transformers where there are big electricity transformers. So avoid that. And of course, certain electromagnetic work atmospheres are there where you would want to avoid that. But most people will be able to do everything normally as they were doing before. And again, going out on a rainy day when there's a lightning, it's like everyone else. Don't be out in an open field because you have a metal here. Electricity, if there's lightning, it may transmit preferentially through you. So therefore, don't be in an open field when it's rainy and lightning. So be away indoors maybe, or in the streets where there are a number of buildings around which will have preference for the electricity conduction.
Oh, right, sir. So this is my personal question to you. So I have this question that what about exercises? Can I, exercise with a pacemaker? Does that by any chance, makes my battery run out faster?
No, no, that's not true either. The exercise we usually limit for the first 2 3 weeks after the implantation, because when you're doing vigorous movement of the arms on the side where you implanted, the leads can get dislodged or displaced or pulled up. So for that purpose, we suggest for after the implantation for 2 to 4 weeks, do not do vigorous exercise of the left arm. But that does not mean on the side where you implant that you keep your arm like this only. If you keep it stiff and don't do anything with it, you develop a frozen shoulder, which will take more than 6 months to get away with physiotherapy and other things. You'll be in big trouble. So don't become stiff and preserve your arm like this. Do all normal things externally, what you do normal day, except that we suggest not to lift your implant side arm up above the shoulder height or behind the back for 2 3 weeks period, so that the leads can anchor well, they mature, so that they don't get displaced easy.
Okay, okay. So now coming to this do's and don'ts, like immediately, since you've already said, immediately after the pacemaker is fitted, what are the advices that I need to follow?
One of the common advices we suggest is, since there is a small scar which is healing, do not apply water there for first 5 7 days, so that this area remains clean and sterile. We ask them to cover it very nicely with a sterile dressing, which we often do in the hospital. And for my personal patients, I suggest not to disturb that dressing, because it's a very sterile dressing. Outside, if they apply some ointment, they use some gauze pieces, how much sterile they are, we don't know. So it is best not to disturb it. We have a small sterile dressing which is sealed from all sides with a micropore, and we ask them not to disturb it for 5 to 7 days. And after that, they can pull it out themselves and throw it away. And if there is any inflammation or anything seen, then they come and see the doctor. Otherwise, they are fine carrying on normal activities as advised. So that is the first advice, not to put water and keep the dressing closed for 5 7 days till it heals. Once this heals, unites, the chance of infection becomes very slow. Second thing we suggest is not to do vigorous movements of the left shoulder and arm, which I've just talked about, not to raise it up above the shoulder height, not to take it back behind the back for 2 to 3 weeks period. By that time, leads have anchored well, the tissues have grown around and holding it in position so that they don't get dislodged easily. Third thing we advise is not to try to sleep on the left side or right side, whichever side is implanted. So if it is implanted on the left side, not to sleep in left lateral decubitus, left side, because the gravity may pull it down and the pocket may be shifted little towards the left, towards the edge of the body. So once it is healed, then you have a fibrous cap going around it, and then the pacemaker does not move a lot. But in the early days, it can move a little bit here or there, and therefore you suggest not to lie on the lateral side too much, so that it remains in position quite okay. Of course, these are the three principal recommendations, advices we do, but otherwise they are advised to carry on normal activities of all sorts, not vigorous activity. Exercising, again, the leads take a little while to mature and anchor firmly. So therefore, for that period, they should not be doing any vigorous exercise, but whatever day-to-day life activities are required, they can carry on with them. They can carry on the walking, they can carry on them going to the workplace, they can carry on their normal work. But if the work involves lifting an arm heavily, etc., that should be avoided for a few weeks.
Okay, thank you, sir. Now let us talk about the risks of a pacemaker. Like, is there any risk involved in implantation of a pacemaker or in continuing with a pacemaker?
Right. Like all medical procedures, there's a small risk involved in any medical procedure. But fortunately, in good centers, the principal risk is that of infection. And that infection rate, like in our case, is very, very low. We have one infection in 20 years or so for each person. So maybe very few infection per year, not much. We hardly have any. But in some of the suboptimal places where the sterility is not maintained well, people can get up to 5 to 7% of infection. And in some of the not so good places, even 10 to 14% infection rates have been reported. Now, apart from infection, the other risks are that you can form a hematoma, the blood collection in the pocket. Second, The lead can get dislodged because the heart is a moving structure. So when you have anchored the lead, it may not stay there. Moving structure may make it dislodged. It may go up somewhere, so it does not pace. Other risks are in long term, that you can get a fracture of the lead because it's bending all the time. You can get fracture of the insulation covering, you can fracture of the lead itself, and that can fail to conduct the impulses when it's required to pace the heart. So that can happen. And of course, the smaller risk of having pneumothorax. When you're puncturing the vein, you may puncture the outer covering of the lung, and air may leak out into the outside the air, outside the lungs, so that we call it pneumothorax. And there can be collection of blood in that layer as well, which could call hemothorax. So these are small related, lead related and pocket related problems. Of course, when you have a leadless pacemaker, you eliminate all these risks because there's no pocket, no surgery to be done here, there's no lead. So you cannot have lead dislodgement, you cannot have lead fracture, you cannot have insulation break, you cannot have pocket hematoma, you cannot have pocket infections. All these complications, which account for almost 60 to 70% of complications, are eliminated altogether
with a leadless pacemaker.
With a leadless pacemaker.
Since we are talking about leadless pacemaker, normal pacemaker, one question is there that there are CRT pacemakers, CRT as well. So what exactly are those, and how does it differ from a normal pacemaker?
The pacemakers have made a significant advances, not just for treating the slow heart rhythm. What happens with the normal pacemaker we implant when the heart rate becomes very slow or becomes nil or becomes inappropriately slow, that's when we implant. But if the heart rate is very fast, pacemakers do not address this themselves generally. So for them, and also when the heart muscles are not contracting in a synchronized fashion, the ejection fraction or pumping action of the heart goes down and they go into heart failure. So in certain subgroup of people with heart failure, where they have a left bundle branch block and where they have conduction abnormality, where there's a dysynchrony between the right and the left ventricle, the two main pumping chambers of the heart, you can synchronize the heart and improve the pumping action of the heart and thereby relieve them of heart failure. And of course, that also increases the longevity of the patients by implanting what we call CRTP for pacing. There's additional lead to be placed here, not in the upper and the lower chamber on the right side, but one going through the coronary sinus vein epicardially towards the left ventricle as well. So once the three chambers are paced in synchrony with each other, the ejection fraction tends to improve in about 70 to 80% of cases, and patients who have a low ejection fraction of 20-25% may come out to have 40, 45, even 50, and even normal sometimes. So 70% of the people respond fairly well to that, and that has become one of the important goalposts in treatment of heart failure who are not responding to medical therapy. In addition, these people are at a high risk of having sudden arrhythmia, which means fast sudden disturbance which causes cardiac arrest. The heart, instead of going like this, started going very fast, thrilling, and this leads to very compromised circulation to the brain, and people may black out or fall out. And this is one of the reasons of sudden cardiac death. You have heard all the time celebrities dying suddenly, usually often because of sudden tachyarrhythmias, very fast heart disturbances leading to collapse and death. To prevent that, we have CRTD. It does the job of a CRTP of synchronizing the heart, but at the same time, it detects the fast rhythm disturbance of the heart and delivers rapid impulses or a minor shock inside the heart to synchronize and bring it back to normalcy. You must have seen in films when they give external defibrillator. This is an internal defibrillator. It gives you a small shock internally and defibrillates the heart and brings it back to normal. The size is not particularly big. You can see this is the size of the device, something similar or maybe slightly bigger in some makes, and the leads are slightly different in this. And once you have this will keep on watching your rhythm. When it requires a pacing, it delivers a pacing. When it requires synchronizing, it will synchronize the heart by placing both the right and the left ventricle together. And when there is a tachyarrhythmia, it will deliver rapid impulses to bring it back to normal. If that does not bring it back to normal, it will deliver an internal shock to bring it back to normal as it has been programmed to. There are a variety of programs you can do so that you have the patient doing a lot of things. They have also become very important diagnostic tools. They can monitor your heart rhythm, atrial fibrillation. They can store the ECGs during the episode, and etc. and so on and so forth.
Thank you for the information, sir. We have just got one question that I'll take before we end this session. Sure. It is, can I undergo medical procedure such as MRI scan with a pacemaker? Are there any considerations or precautions?
Right. Normally, when you have a pacemaker, standard pacemakers, what we used to implant, they were not MRI safe. It is not just the pacemaker, also the lead has to be MRI safe. Since they were not MRI safe, we were suggesting that they should not have MRI scans, they should go for a CT scan instead. However, for last decade or so, we are now have MRI safe pacemakers available. Once they are implanted, all you have to do is program it to MRI safe mode just before the MRI scan and program it back to non-MRI mode after the MRI scan has been done. So you can do MRI scans safely nowadays with MRI safe pacemakers and the leads.
Thank you, sir. It was a very informative session today. But before we end, I would like to ask you one thing. Any advices that you have for our audience who are watching today?
I think one principal advice which I find very commonly being ignored is if you have a sudden blackout, sudden giddiness, a sudden palpitation and a blackout, you should see a cardiologist to find out whether it's a rhythm disturbance of the heart which may require a pacemaker or which may require a CRTD or ICD or devices of that sort to help you and prolong your longevity and save you from the troubles which you have when you have these problems.
Thank you. And with the advance, I hope that today's session was informative enough to let you know regarding the do's and don'ts of pacemakers and the advancement in the modern science in cardiology. For any appointment with Dr. Anil Mishra, we are here at BM Birla Heart Research Center. He's here as the Director of Cardiology, and he's here to see you. You can visit him for any kind of questions or any kind of ailments that you are having with your cardiac issues. So for today, I will be ending the session here. For any further questions, if you have, you can definitely put it in our comment section and we will be answering it shortly. Thank you so much.
Bye for now.
Bye.